Hi, Dr. Greger.
Uh, can you
Welcome.
can you hear me okay?
Yes, can you hear me?
I can hear you fine. I just got a low volume warning from this program, but if you can hear me fine, we're good.
Yeah, it's all good. And I see you're on your treadmill.
Always.
That's excellent. So happy to spend the next several minutes with you. Thank you so much for joining me.
So happy to help.
All right, so we'll jump right into it. I actually had provided to our viewers, this is being recorded, and
Okay.
I provided to them a little background, your bio, and all the great work that you're doing through nutritionfacts.org and the books that we actually have on
Oh, look
display,
at you.
all of your
All
books.
right. Very nice.
Yeah, so huge fans here. And again, just thank you very much for spending some time. So we'll jump right
Absolutely.
into it.
Let's do it.
Yeah. So, I actually was so intently watching your relocation a year or so ago, and you landed in Philadelphia, which I hold a place in my heart with Philadelphia. I had actually done my medical training and lived there for about 15 years. How are you
Oh,
enjoying it?
fantastic.
How are you enjoying Philadelphia?
Well, if you look closely at my background, I'm no longer in Philadelphia.
Oh, well,
You just missed me.
just missed you. Okay.
That's
Well,
right. Right now I'm quarantined in California. But yeah, unfortunately I'm leaving Philadelphia, but I loved it while I was there.
yeah, yeah. Well, California is not a bad place to be either, I would say. So, well, maybe I'll orient you a little bit to where we are. We're in Grand Rapids, Michigan, and that's on the west side of the state of Michigan. And wanted to share with you a little bit about Spectrum Health. That's a healthcare organization that I work with, and where our lifestyle medicine practice is located. We're a not-for-profit. We're an integrated health system. We actually have 14 hospitals
Ah,
all along the west side of Michigan. And I thought you'd also be interested. We train medical students here from Michigan State, the College of Human Medicine, and we have about 30 residency programs, fellowship programs
cool.
here.
I wish I could be there to check it all out myself.
Well, hopefully that day
Stupid
will come.
virus. One of these days. Yeah, looking forward to it.
Absolutely. But I wanted to start by just bringing up the fact that in the Midwest and in the Grand Rapids area, that plant-based eating may be a new concept to many. And how
Yeah.
would you describe plant-based eating to our viewers?
Well, I mean, I think the best available balance of evidence suggests that the healthiest diet is one that minimizes the intake of meat, eggs, dairy, and processed junk and maximizes the intake of fruits, vegetables, whole grains, legumes, which are beans, split peas, chickpeas, and lentils, nuts and seeds, mushrooms, herbs, and spices, basically real food that grows out of the ground from fields, not factories. These are our healthiest choices.
Absolutely. You've even been quoted as saying that it's the most important decision that we make, what we put in our mouths. And what are some of those powerful benefits that we get from plant-based
Oh,
eating?
I mean, it's not an opinion. This is the Global Burden of Disease Study, the largest study of disease risk factors in human history, funded by the Bill and Melinda Gates Foundation, found that the number one cause of death in these United States is the American diet. Also, leading cause of disability. You know, cigarettes these days only kill about 500,000 Americans every year, whereas our diet kills many more. So it's the most important decision we make for the health and well-being of ourselves and our families. And the good news is we have tremendous power over our health, destiny, and longevity. The vast majority of premature death and disability is preventable with a plant-based diet and other healthy lifestyle behaviors.
Yeah, I love hearing that, and just the hopefulness and that message that we have so much, power and control over our health. It's
That's right.
amazing.
That's right.
Uh, so our lifestyle medicine team here, so it's myself, another physician who's certified in lifestyle medicine. We have a registered dietitian who's also going to be a health coach soon.
Great.
And yeah, we actually offer a series based on your Daily Dozen app, which
Oh, cool.
it's, yeah, it's been so much fun. We actually have run that series now, well, coming on our third time. And what we do is we take your Daily Dozen app and we encourage everyone to download it who joins us for the series. And then we break down 2 of the 12 topics each week over 6 weeks and kind of coach people through adopting a plant-based diet.
Awesome. I love it.
We give them some challenges, including watching some of your nutritionfacts.org videos.
Uh-huh.
And then we pair it with some educational sessions that we do kind of one-on-one with the groups, and then give them some recipe demos. So
I
lots
love
of
it.
great things that,
I love it. Oh my God, you should export it to the hospitals all over. This is amazing.
yeah, I thought you'd be excited to hear about it. It's just been a real thrill and joy to deliver the content because you make it so approachable, and then we get to bring our flair to it and have everybody kind of enjoy the
I love it.
sessions.
Oh my God, you should. Is there something written about this online? I'd love to plug it, get it out there.
Oh, well, this will be part of it. I think just, bringing your awareness to it, and then, yeah, I'd be happy to share more
Yeah,
information. And
yeah, I'd love to get it out in the world in hopes that Spectrum can be used as a role model for other health systems throughout the country.
oh, I love that. Yeah, that's so awesome. Thank you for that. And, I'm curious, how did you come up with the Daily Dozen? How did you come up with that concept?
Yeah, well, so yeah, so it's from the what 3 books ago now, How Not to Die, where the first half of the book is just 15 chapters on each of the 15 leading causes of death, and just talk about the role diet may play in
Mhm.
preventing, arresting, or reversing each of our top 15 killers. But I didn't want it to just be a reference book, right? I wanted it to be a kind of a practical guide on making day to day kind of grocery store type decisions. So that's really what became the second half of the book, where I centered my recommendations around this daily dozen checklist of all the healthiest of healthy foods I encouraged people to fit into their diet. So, berries every day, the healthiest fruits, greens every day, the healthiest vegetables, a tablespoon of ground flaxseed, quarter teaspoon of turmeric, the best beverages, the best sweeteners, how much exercise,
Yeah.
just in hopes of inspiring people to kind of include some of the healthiest of healthy foods into their daily diet. And the way it actually came about is, I'd be doing research and come across some amazing thing, and I'd be like, oh, so study came out saying eating ground flax seeds lowers the blood pressure as much as leading blood pressure drug, with of course out the side effects and all
Fascinating.
sorts of other benefits. And I'm just like, oh my God, that's amazing! I got to go out and buy some flax seeds. And so I've eaten flax seeds for a while, but then like a year later or a couple months later, I'd read about some other amazing thing about flax seeds, like significantly improving breast cancer survival, reducing recurrence rates, and I'm like, oh my God, this is me. And then I'd realize, oh, I totally forgot about flax. I was eating it for a while, but then I ran out and I didn't get more, and like, boy, I really got to eat flax seeds. Um, and amazing things about berries, and like, oh, when's the last time I ate a berry? Darn it! So I actually started a little whiteboard on my fridge, like a little,
So it was a
it's like, okay,
checklist for
I got it.
yourself.
I got to eat beans I got to have some kind of bean
Uh-huh.
every day. This is American Institute for Cancer Research recommendation. We have the legumes. Even recommend every meal 3 times a day legumes. I'm like, all right, okay, I got to eat more beans. How am I going to eat more beans? And so, I'd like check it off during the day, and the whole family got involved, and just trying to to remember all these great things. And so that's really kind of the and now available as a free app, iPhone, Android, and
Absolutely.
yeah. So, but yeah, it all really started for myself, just as a
Hmm.
reminder. And then, of course, once you get in the hang of it,
Right.
you're like, oh, when you have your oatmeal, you have the flax seeds, but for those that this is completely new to them,
Right.
it's you can use a kind of little game just to say, ooh, how can I make my daily diet even healthier?
Exactly, and to help build those habits in, as you mentioned, until they become just second nature in what you do. And I love it because it's all based on the scientific evidence and the fact that you then link it to the videos that really help highlight those topics even more. So
Right.
it's so helpful to people. And we actually at Spectrum Health have something called App Script where we can prescribe apps. It's like an app formulary. And
Cool.
your Daily Dozen app was one of the first that we loaded in.
Oh,
So
how cool.
yeah, so lots of physicians here can actually prescribe that directly to their patients to really,
Cool.
encourage those healthy habits. Yeah.
Love it. I love it.
One thing that I had done prior to our conversation today was reach out to our 30,000 Spectrum Health employees to see what questions they might have for you.
Uh-huh.
And so I do have one as we're talking about the Daily Dozen. Now, soy food is not specifically listed on the Daily Dozen. We know it's a legume, so it's in there, but not called out specifically. But one of our Spectrum Health employees is feeling confused, like a lot of people are, about soy foods. Are they healthy? Are they not? And he wanted to know specifically, is it okay for men to eat it? And how about for women who have a history of breast cancer?
Yeah, soy is really misunderstood. People don't understand. There are two types of estrogen receptors in the body, alpha and beta, and the phytoestrogens. These estrogen-like compounds found in soybeans bind preferentially to the beta receptors, whereas our own endogenous estrogen binds preferentially to alpha receptors. And so the effect of soy on different tissues depends on the ratio of alpha to beta. And so estrogen, look, has positive effects on some tissues and negative effects on others. So, for example, estrogen is good for the bones, but bad for the breast in terms of breast cancer risk. So ideally, we'd have some kind of selective estrogen receptor modulator that have estrogenic effects in some tissues and kind of anti-estrogenic effects in the others. And that's exactly the role that these soy phytoestrogens play. So soy, for example, lowers breast cancer risk and associated with prolonged breast cancer survival, significantly reduced cancer recurrence rates. And so that would be an anti-estrogenic effect. But at the same time, soy foods reduce menopausal hot flash symptoms, right? Which is actually a pro-estrogenic effect. So with soy, you get kind of the best of both worlds. And so we should eat legumes, beans, chickpeas, lentils, including soybeans,
Mm-hmm.
as one of the options every day. So
That's
yeah,
great. Yeah,
good healthy soys. Now, of course, there's healthier and less healthy soys.
sure.
A pint of soy ice cream, not
Right.
the best
Not so good. Yeah.
source. But you can get, unprocessed soy. You can get
Yeah.
soybeans in a can, just like other beans, or you can
Uh-huh.
get edamame, the immature green
Yeah.
soybeans in a pod. Super fun
Hmm.
to eat. Kids love them. Delicious.
So true.
Miso, tempeh, lots of whole soy foods out there that have all the nutrition without having some of it processed away.
Yeah, I love that. And in some of our culinary medicine classes that we have here, we, teach people how to work with tofu because it can
Right?
be one of those food items that people are really scared of.
Right?
And
Yeah, sure.
yeah, so breaking down the science of it so, they understand how good it can be for you. And then actually, how do you cook with it and make it taste delicious? Because we want
Exactly.
everybody to enjoy their food, right?
Right. Exactly. No, absolutely. It's not just the why, but we need to give them the how.
Exactly. Yeah. So I want to switch over and talk a little bit more about the growth of lifestyle medicine, if you don't mind, and maybe some of the interesting tidbits that I've gained knowledge from your recent book, How Not to Diet.
Ah,
Some really fascinating stuff. I love that book. I'm curious. Obviously, you speak to many people internationally, and just hearing testimonials, I would imagine that you've heard many as people have transitioned their diet and
sure.
improved their health. Are there a couple stories maybe that stick out that might resonate with our viewers here?
Oh my God. Well, I mean, the story that for me that started it all was my grandmother. That's the reason why I do what I do today. That's why I went into lifestyle medicine. I was just a kid when my grandmother was sent home in a wheelchair to die with end stage heart disease. She already had so many bypass open heart surgeries. You basically run out of plumbing at some point, get so scarred up inside. And so there's nothing more they could do. Confined in a wheelchair, crushing chest pain, her life was over at age 65.
Oh, wow.
But then she heard about this guy, Nathan Pritikin, one of our early lifestyle medicine pioneers. And what happened next is actually detailed in Pritikin's biography. It talks about Frances Greger, my grandmother. They wheeled her in, and she walked out within a few weeks. She was walking 10 miles a day. And even though she was given her medical death sentence at age 65, thanks to a healthy diet, was able to enjoy another 31 years on this planet till
Wow.
age 96 to continue to enjoy her 6 grandkids, including me. And so that's why I went into medicine. That's why I practice lifestyle medicine, why I started nutritionfacts.org, why I wrote the book, How Not to Die, why all the proceeds from all the sales of my books are all donated to charity. I just want everyone to have access to this life-changing, life-saving information. I just want to do for everyone's family what Pritikin did for my family.
What an inspiring story. And I love that you also mentioned that it was only a few weeks where she started to feel this amazing
Unbelievable.
change.
Unbelievable. Right?
Yeah, and
And
that's
right. And you don't know how good you're going to feel until you give it a try.
right. Yeah. So again, that really hopeful message that lifestyle medicine can not only prevent disease, but even advance disease. We can begin to reverse it. And at times it can symptomatically go away. And even on our diagnostic imaging and procedures, we can see it visually go away. Incredible.
Arteries opening up without drugs, without surgery. We've known about this since Dr. Dean Ornish's landmark lifestyle heart trial back in 1990. We've known for decades that we can reverse this disease, yet there's only one diet that's ever been proven to reverse heart disease, the #1 killer of men and women in the majority of patients, and that's a diet centered around these whole plant foods. And
Hmm.
look, I mean, if that's like all plant-based diet could do, reverse the #1 killer of men and women, I mean, shouldn't that be kind of the default diet until proven otherwise? And the fact that can
You would
also be
think.
so effective in preventing, arresting, and reversing other leading killers like type 2 diabetes and high blood pressure would seem to
Mhm.
make the case for plant-based eating simply overwhelming at this point.
I couldn't agree more. And, speaking about that, I know you are, at least virtually now, getting out and trying to educate medical students. I know when I was a medical student and resident that the amount of nutrition education that I got was about, that much. It was inconsequential to everything else that I had learned in terms of, pharmacology and how do we treat diseases once they've started, not necessarily how do we prevent them and use these lifestyle factors to reverse them. And I'm curious, what are you saying to medical students now about the importance of evidence-based nutrition and why they should learn it?
Yeah, yeah. Is things any better at the school there associated with Spectrum?
We've been fortunate because we have strong executive leadership to really bring lifestyle medicine in and to work with our medical residents. So we're really focused on the, training physicians right now, trying to fold in the medical students as much as we can. But we have quite a robust culinary medicine program. So, and we're in our 4th year of that program now.
Cool.
So, we're making some progress, but there's still a lot more education that needs to happen so that medical students, practicing physicians can feel confident in using these tools to really help their patients.
Yeah, doctors really have a severe nutrition deficiency in education, right? I mean,
Yeah.
most
Yeah.
doctors were just never taught about the role healthy nutrition can play
Mhm.
in the course of illness, and so they graduate without this powerful tool in their
Mhm.
medical toolbox, right? Now,
Yep.
yes, there's also institutional barriers,
Mhm.
such as time constraints and lack of reimbursement. General doctors
Mhm.
simply in this country aren't paid to counsel people on how to take better care of themselves. And
Mhm.
look, of course, drug companies play a role too in supporting medical education and practice. You can ask your doctor when's the last time they were taken out to dinner by Big Broccoli. It's probably been a while. But
Yeah.
yeah, yeah. I mean, it's kind of a, I make this parallel to like smoking in the 50s. We had
Mhm.
decades, even by the 50s, linking conclusively smoking with increased lung cancer risk, but it was ignored because
Right.
smoking was normal. Most doctors smoke.
Mhm.
Right? The average per capita cigarette consumption is about 4,000 cigarettes a year, meaning the average person walking around smoked half pack a day on average, right? The American Medical Association was reassuring everyone that smoking in moderation was fine, right? In moderation, right? There was this disconnect
Mm-hmm.
between the science and public policy. And it took
Mm-hmm.
more than 25 years and 7,000 studies before the first Surgeon General's report against smoking came out in the 1960s, right? Until the system changes. And we see this similar situation today with diet, where the
Yep.
science is on one side, but we still haven't caught up. And until the system changes, we need to
Mm-hmm.
take personal responsibility for our own health, for our
Mm-hmm.
patients' health, for our family's health. We can't wait until society catches up to the science again, because it's a matter of life and death.
So true. And, one of the interesting things that we see when we're working with residents and other physicians in, for example, a culinary medicine class, is I often then hear about how they've changed their own habits based on this new information that they've learned. So that inspires me to keep doing this work. It is an uphill battle at times, but it's so important, so critically important. Actually, around that topic, another one of our Spectrum Health employees had wanted to ask around this moderation concept and your thoughts on if the data supports, do we need to be 100% plant-based, or is it okay to be kind of mostly plant-based? What
Hmm.
does the data show around that?
Oh yeah, well, so I mean, moderation, the concept of moderation, this is something the food industry loves, because if you
Yeah.
actually do research, if you actually do surveys and ask people what moderation means to them, like what's
Mhm.
eating chocolate in moderation, or what's, on down the list, and it turns out the people's answer is that whatever their current consumption is, that's moderation. So if
Oh.
people eat chocolate 3 times a day, they think that's moderation. And so it's the perfect message for the corporate world, because it's basically eat
Whatever
in
you want.
moderation,
Right.
telling people eat exactly how much you're eating right now. So it's a meaningless term.
Right.
And so that's exactly the way the processed food industry wants it.
Mm-hmm.
But in terms of the proportion of whole plant foods that make up your diet, basically the more the better. But no, it's not something to get obsessive about. It doesn't matter what you eat on your birthdays or holidays or special occasions. It's
Sure.
really the day-to-day stuff that adds
Mm-hmm.
up, right? I mean, your
Mm-hmm.
body has this remarkable capacity to bounce back
Mm-hmm.
from insult, as long as you're not poking it with a fork 3 times a day. So on a
Right.
day-to-day basis, we really should try to eat as healthy as possible.
Mm-hmm.
But it's not like, but it's magical thinking to think that once in a while we're really going to do ourselves a damage, unless it's some kind of food safety event or something.
Sure. Yeah. So then, yeah, day to day, really striving for that, whole food diet centered on plants. I mean, that's absolutely what the science indicates. But yeah, on your birthday, if you're going to have a slice of cake, then, let's not obsess about that. I
Two
couldn't agree more.
slices.
Two slices. All right. You heard it from Dr. Greger. In regard to your most recent book, How Not to Diet, I was fascinated to learn some of the science that you really brought to the reader, and in terms of how to maintain a healthy weight. We know so many people are struggling with that. It's a huge challenge in our country. I know it's a problem here in Grand Rapids, and including childhood obesity.
Yeah.
So is that one of the motivations that you had to write the book, or what were your thoughts around that?
Yeah, with so much nutritional noise and nonsense out there these days, I just wanted there to finally be an evidence-based diet book. And to
Mhm.
that end, I cite literally thousands of studies, digging up every possible, tip, trick, tweak, technique proven to accelerate the loss of body fat, to give people every possible advantage, and basically build the optimal weight loss solution from the ground up. That was really what I was thinking going into the book.
Yeah. Yeah, and one of the topics that I found particularly interesting, and the science around time restricted eating,
Oh, so
it's
cool.
incredible.
So cool.
Yeah.
Yeah. So that's part of this broader field of biology known as chronobiology, where, and we've always, I mean, well, not always, we've long known about this concept of chronotherapeutics. Like you can time chemotherapy different times of the day, different times of our circadian rhythm, and have different side effect profiles,
It's
even
fascinating.
potentially different efficacy. Same drug, same dose of the drug, given at a different time of day. Remarkable. So maybe it should not surprise us that there's also chronoprevention strategies where
Right.
the timing of exercise or meals or
Mhm.
can also have different effects based on different times during the day, given how much of our biology is driven by this daily circadian rhythm. And also there are seasonal effects as well. And so, I mean, this is a field that I was completely ignorant about until I took on this book and was really shocked. It's actually one of the things that's actually changed my own family's
Hmm.
day-to-day eating habits, because the evidence is really remarkable. So basically, kind of the bottom line is we should try not to eat after 7 p.m. The fewer calories after the sun goes down, the better.
Hmm.
Food eaten at night is literally more fattening than the exact same food eaten earlier in the day.
Wow.
And so
Yeah.
you can do these remarkable studies where you can give people the exact same number of calories, and calories are just less fattening in the morning, and it's because the way our body works with circadian rhythm. And there's also benefits to not eating all the time. Most Americans eat kind of around the clock. So not only should we try not to eat after sundown, but restricting our daily feeding window to 12 hours or less,
Hmm.
the so-called time-restricted eating, there are
Yep.
independent benefits. But then if you combine both concepts, so a restricted daily window
Hmm.
earlier in the day, and
Yep.
trying to to stack our calories more towards the beginning of the day,
Hmm.
the better. So largest meal of the day, lunch rather than supper. If we're going to skip any meal, we'd be skipping supper, not breakfast. Certainly, it really is the most important meal of the day. And so weighing our calories towards the beginning of the day, not eating after sundown, even if you're eating the exact same miserable, terrible diet. I mean, it's just crazy.
It
Um, uh,
is.
so those two pieces of cake, you have them in the morning of your birthday, because they're actually less dangerous. You actually have less of a blood sugar spike to eating garbage in the morning than you
Wow.
have garbage in the evening. Now, ideally, we do the best of all worlds, right? Eating a
Sure.
healthy diet and having additional benefits by eating earlier in the day and restricting that eating window. Really remarkable science out there. I was really excited to write that chapter.
Yeah, I love reading that. I keep going back to it because I think it just makes sense too, but we've gotten so far away from that where, food and food access is open 24
Yeah,
hours a day, and we don't give our
everywhere.
bodies that time to rest. And and the science really supporting that we can improve our health by just shortening that time
Yeah,
eating window.
yeah,
It's fascinating.
yeah.
So yeah, I was really thrilled to read that. And it's a concept that I've been trying to implement as we do some of our lifestyle medicine webinars, because I also think it in the science shows, as you noted in your book, that it's something that people can easily do and sustain,
Right,
which is so important, as
right,
we know.
right.
We need to,
Really simple rules. Yeah, really
yeah,
simple rules.
yeah, yeah. So that's great. And also, what I also found interesting in the How Not to Diet book is that it ends up leading you back to the daily dozen foods, right?
Right,
So it's
right.
almost like full circle. And I'm curious if you could share, like, what were some of those features of the daily dozen foods that suddenly became optimal sort of weight maintenance foods
Yeah,
too?
yeah. No, it's funny. So, after How Not to Die was published, we made the app, the Daily Dozen app called Dr. Greger's Daily Dozen. It was downloaded, a million times, and but it's interesting. We got two major kind of themes of complaints about the app. Number one, it was just like way too much food. Like, oh my God, right? But then the other major complaint is like, wait a second, there's just not enough calories to sustain oneself. I said, wait a second, too much food, too few calories.
Like the
It's like the
perfect,
perfect weight loss
yeah,
diet.
right.
Um, uh, so you're offering basically maximum nutrition with
Hmm.
minimum calories. That's centering one's diet around this whole healthy plant foods. So if you think about it, diets really ideally should be safe, nutritious, healthy, sustainable, right? The goal of weight loss is not to fit into a skinnier casket, right? But thankfully, what appears to be the most effective weight loss diet also
Mhm.
just so happens to be the only diet ever proven to reverse heart disease, right? So the
Right.
healthiest diet, the best diet for weight loss. We don't have to like mortgage our health to lose weight. You really get the best of both worlds.
Absolutely. And, you know, I don't like to ever, when we're teaching classes, for example, focus on any of the specific macronutrients. That's a bygone era,
I
thankfully,
agree.
that we don't focus there.
Sure.
But focusing on having enough fiber in your diet. And as we know, you only get fiber through plant foods and all the amazing benefits around that. So, yeah, it's fun to kind of work with these concepts and see what resonates with individuals as they try to make these changes and improve their health. So, and with that, I kind of wanted to switch. I know you have another book. I don't know how you managed to write all of these books. It's just phenomenal. But How to Survive a Pandemic, as we know, we're all kind of living in this era. And what does a whole food plant based diet do in terms of kind of boosting or helping our immune system?
Well, I mean, it's critical to consider the underlying risk factors for COVID-19 severity and death.
Mhm.
Obesity, hypertension, type 2 diabetes, and heart disease, right? All of which can be controlled or even reversed with a healthy enough plant-based diet. So that's really kind of the
Yeah.
key during this time in terms of healthy eating. So we should all take this time. If
Hmm.
you are privileged enough to not, be on the front lines, we should take this time to get sufficient sleep and keep active and
Yep.
reduce stress and staying connected, albeit remotely, with friends and family and eating a healthy diet. Like this is the time to really establish those lifelong healthy habits, which will not only protect us now to keep
Yep.
us healthier from the current virus, but protect us in the future from chronic as well as infectious disease.
Kind of doubling down on all these lifestyle habits to, yeah, to try to build that armor against coronavirus or influenza or whatever other situation we find ourselves in. So, I want to kind of introduce you to. I know I talked about our health system, but I'm actually in the practice location of our lifestyle medicine clinic. And
Cool.
I think you would be thrilled to know, and I'm going to move the camera for a
Let's
second.
see what we got. What
It's
we got
it's
here?
in a teaching kitchen.
Oh, yummy.
Yeah. So
Wow,
we have,
cool.
yeah, we have 6 teaching kitchen stations, and once we're able to get back to more in-person programming,
Sure, sure.
we actually been doing a lot of virtual programming, which has been fantastic. But this is going to be the site where we care for patients, that we kind of work with them to build these great habits, teach them. We have a chef on our team that can really work with them to make the food delicious too, although it's naturally delicious, as we
Of
know.
course. Oh, well, that is fantastic. I'm looking very much forward to visiting and seeing it all for myself.
Yeah.
Unfortunately, I got another interview. I got to jump off.
All
Uh,
right, well, thank
but
you so much. I so appreciate your time. This has been fantastic, and huge fans here in Grand Rapids.
oh, well, I'm so glad. Looking forward to being there in person.
All right, take care, be well.
Bye.
Bye.